Doctors worldwide currently practice systematic, legal, permanent internal mutilation. Doctors implant a wide variety of synthetic surgical meshes, medical devices cleared by the FDA's flawed 510(k) process, and manufactured by greed-driven pharmaceutical companies. Doctors implant mesh for hernia repair, bladder suspension, and pelvic organ prolapse. Think about the luscious feeling of a penis plunging into a vagina, the wonderful soft warmth of the vagina receiving the strength of the man's penis. Then think about that same plunge, and it includes the cut edges of a window screen. The man is injured going in and out. Or maybe the man does not feel it, but the female partner is in a fetal position for the next 3 days from the pain caused by a beautiful, intimate act. Or maybe a man's spermatic cord is crushed by hernia mesh, causing him to be sterile. Or depressed and crying at a sad movie due to low testosterone. Or perhaps one or both of his testicles have to be removed. Sound like a horror movie? It is, but it's not playing at your local movie theater. It is playing in patients' lives, in patients' homes, in patients' bedrooms all over the world. These are real people with real lives who were devastated by a doctor picking up a scalpel, cutting them open, and surgically implanting a permanently placed, petroleum-based, toxic medical device called synthetic surgical mesh in their bodies. I know these real people because of my own nightmare journey caused by mesh. The journey started on a gurney downstairs in the hallway of Jackson Memorial Hospital early Christmas morning 2001 as I waited for surgery. The doctors in the emergency room had told me there was a 40 to 50% chance I would not survive the surgery they were about to perform. Now at 4 a.m. laying on that gurney, I prayed, Lord, if you want to take me home, it's okay. I get to see my mama and my daddy. And if you don't, that's up to you. Dr. Bernard Kanter had performed a hysterectomy and a bladder suspension with a new tape as he called it. You will really like it, he said. As he was the chief of gynecology at Mount Sinai Hospital in Miami Beach, I asked no questions, thinking, oh, it must be something like a ribbon. After all, he was a doctor, and I was much more concerned at no longer being a fertile woman than a tape the doctor was going to use. Well, I should have been very, very concerned. Dr. Kanter implanted one of those petroleum-based, permanently placed, toxic medical devices, permanently, internally, and externally mutilating me. I was in the hospital almost 3 weeks, in bed for 3 months, and unable to work for 6 months. Despite being a long-term successful steel broker, I wound up bankrupt and homeless and hungry. I was stunned at what had happened to me. No one could tell me or would tell me how I had gotten a flesh-eating bacteria. I wanted to know. I never wanted it to happen again. I wanted to be sure I never, ever put myself in such a life-threatening position. Searching for answers brings us here today, almost 9 years later. Searching for my own answers is why I know those real people with real lives who were devastated by a doctor picking up a scalpel to implant mesh. None of us knew our fate, but the FDA, the CDRH, pharmaceutical companies, medical device manufacturers, and doctors certainly did. They did not know our names, but they certainly knew they would harm us. They added a line item percentage to their financial statements to cover the cost of defense attorneys and bad verdicts when we file suit against them. Of course, there is no line item to pay for our pain and suffering and medical costs or to prevent bankruptcy for myself and all those other real people. Why do doctors continue to use a medical device that causes so much serious harm and even death? The conversation has to change. The discussion has to be getting synthetic surgical mesh off the market and finding ways to make patients suffering permanent disabling complications whole again.
I had surgery in 2004.
In 2005.
In June of 2006.
I was in November of 2006.
April of 2007.
I went in August of 2007.
November of 2007.
I had my surgery April 2008.
I had a small inguinal right indirect hernia. I had Marlex mesh implanted without me actually knowing the mesh was going to be implanted.
I went in first to repair my small hernia, and I had 2 large mesh implants put in, and left me in chronic pain. I've been through 9 hours of corrective surgery, peeling the mesh off my bladder, spermatic cord, nerves, ligaments, picking out of the veins running down both legs.
It was over 4 years that I had to deal with the complications. I couldn't breathe without it ripping. I couldn't walk. Lost my life in a lot of ways that I once lived before that.
Tried to go back to work. It was a joke. I ended up going on disability 6 months later. And that was several years ago. I've had multiple surgeries, procedures, physical therapy.
I was sold on this product by the physician, stated you'll never look back and you won't feel any pain and you'll be back to work on Monday. And that was 6 years ago.
I researched the product that he was going to put in, and there was nothing nothing I could find that was adverse. 4 weeks after the surgery, I developed a condition that was extremely disconcerting. I felt actually physically aroused all the time.
I've been pretty much downhill since. I'm waiting. Lost job, lost everything. And I'm waiting right now. I don't have any insurance to attempt to get anything else fixed. So, you guys have all gone through all these surgeries, and I've had 2.
I've had numerous surgeries to try to correct the problem.
The next day I knew I was in deep trouble. I couldn't walk. I couldn't get out of the bed by myself, and I needed a walker. Needless to say, to make it short, I've had 2 removal surgeries, but in the context of that, I lost my ability to walk without limping, or the mesh sliced through my urethra. I couldn't urinate. It pulled down my colon, which in turn pulled down my bladder and my uterus again.
So a few months later, he removed part of that mesh, and I was in intense pain, difficulty walking, lost a lot of weight, had a lot of symptoms, and he said, I don't know what's wrong. It's not your mesh. We don't know what is causing this. And then in July of '06, I had the mesh totally removed in Connecticut, and that didn't stop the pain because I had a lot of inguinal nerve injuries. And then I had a massive recurrence because the defect after removing the mesh was tremendously larger than my original hernia was. It was a small hernia, now it was a tremendously large hernia. So I had to have a large sheet of Ultra Pro mesh, which is about the size of a sheet of paper now, covers my abdomen, to repair that hernia, and continued on with tremendous chronic pain from nerve injuries and spermatic cord injury, lost the testicle from that surgery.
I went to see Raz. I found Raz from Truth in Medicine. Alana told me about him, and we saw him 5 months ago and had surgery with him. And I can breathe now, I can walk, and I'm not scared to take every step and have a fall. He fixed that. So I definitely have had progress and a little bit of improvement, but I still have chronic pain.
Finally found Dr. Roz at UCLA and had some more surgery in July. And so I'm doing a lot better than I was, but I'm still having problems, and I'm heading back out there in October for probably another small procedure.
I kept researching. I looked all into the pudendal nerve, which again, nobody really, not my area of expertise. I talked to a doctor in Houston, and it was through the pudendal site that there was a link to women's sexual health, and that is the link. Then that link linked me to medical mesh. And it was through Leanna's suggestion that I see Dr. Roz or Dr. Larissa Rodriguez at UCLA that I found relief. He knew immediately, the first appointment. He said, this is, your mesh is going through the obturator and it's rubbing on the corpula nerve. So September 25th, the day that they had their first conference, I was having surgery with Dr. Roz. I feel very fortunate. I had only had the mesh in for a year.
I had my mesh removed by Dr. Bruce Ramshaw, University of Missouri at that time, April 2007. And I'm better now. I've gotten out of a wheelchair. but I still live with chronic groin pain and right testicular pain.
I just completed my 6th surgery at UCLA with Dr. Roz 11 weeks ago. So time will tell and see if that worked or not. But it's been a very long journey, very painful.
I feel very fortunate, and I feel like I owe my life to this group.
There are no doctors on the internet. There is nobody that's saying, hey, we can help you and you do have a problem, we'll support you. That's what Truth in Medicine is. That's why we're growing the organization. I have hundreds of people that have contacted me over the years, and most of the people are not here because they're either sick or broke or can't move or whatever. And so it's heart-wrenching, and that's why I'm just so determined to bring the talent we have here today to talk about what's going on and make sure that this doesn't happen to other people. And I know it's really hard to listen to a bunch of people talk about their own personal medical history. It's like, oh my God, do I have to listen to that person, you know? But each one of us, we deserve to be respected as individuals. We're humans, and we need to be appreciated by the fact that who we are. And I firmly believe the culture has to change, that patients are disposable.